this is Andrea. I want to take some time. This is Andrea from Adams Nursing Reviews to Completion. I want to take some time to go over the 4 main books that I will be using and recommending for this review. It seems like a small list. Obviously, you can add additional books that you want, but these 4 books will be enough for you to be successful on the NCLEX examination. So, the first book I'm recommending, these don't come in any particular order. I am just simply going over all 4 books. This one is the Medical Surgical Nursing Review, and this is by Hurst. And I find that this book is particularly very good in that it goes over all of the information that the nurse needs to know about each body system, each disorder in the body system for the medical surgical focus, which is a large part of the NCLEX examination. So this book is very thorough. I love it because it focuses on the key nursing management, the key assessment, the key diagnostic tests, and so forth. So it keeps the student who is preparing for NCLEX, which you are, in focus. So I love it because it's simple, it's clearly organized, it's very simplified in the communication. So this one I highly recommend, and I use it, and I recommend that you use it. And it's written by Marlene Hurst. Okay, the next book is also written by Hurst, and I think she's excellent, by the way. And this one is Pathophysiology Review. As you know, anatomy and physiology is the most important course, and then there's pathophysiology, which is extremely important because pathophysiology deals with altered anatomy, altered physiology. Anatomy and physiology deals with normal body function. Pathophysiology deals with altered body function. So many times people struggle with NCLEX examination because they don't really understand the pathophysiological basis of an illness, and therefore, if you understand the pathophysiology basis of an illness, you understand the etiology, the cause, you understand the pathogenesis, how that disease evolves over time. You understand the key clinical manifestation. These are the subjective things that the patients report, the objective findings on assessment, on diagnostic workup, and also the pathophysiology dictates the nursing management. It dictates the type of medications that will be used. So everything begins with pathophysiology. It doesn't matter. So this review book, I love it because it simplifies the pathophysiological basis for disease, the diseases that are very common: diabetes, hypertension, coronary artery disease, liver failure, renal failure, shock, infectious disease, all of the important diseases that the new registered nurse needs to understand and learn, and can quickly in his or her mind get to the basis of the disease and understand it. This book is clearly outlined, it's focused nicely, it's an easy read, and it's an easy comprehension level. Highly recommended. The next book I recommend is Saunders Comprehensive Review. And I love Saunders Review. In 1994, I took my NCLEX exam. During that time, it was the first time NCLEX exam was offered to on the computer, and my class, we were the first class to do it. So I know what you're going through right now. And Saunders Review was one of my books. It is solid. It is solid. I love it because Saunders Review focuses directly on all of the important things that you need to know for NCLEX. The information is organized nicely. It starts with the disease or the illness, and then it goes into a description of it, the pathophysiological basis of that disease, clinical manifestation, signs and symptoms, the nursing management, the pharmacological management, the diagnostic test. So this comprehensive review covers every single disorder that NCLEX is concerned about. Doesn't have a lot of rare diseases in here because NCLEX is not concerned about things that does not affect the majority of the population. This is very structured, very organized. Every chapter comes with review questions. The questions are outlined based on the level of application, competency, and so forth. So it's excellent. Okay, it's a book that every graduate who is looking to pass NCLEX should go through thoroughly. You go through Saunders' review comprehensively, you will pass NCLEX, okay? And this is a review book that you don't go through it when you're tired. You go through it when you're optimized, when you feel that you can go through it. The newest edition is the 7th edition. I recommend it. I love it also because it looks also at the legal aspect of nursing. It reviews growth and development. It reviews fundamental concepts in infection control, in perioperative care, and it's just really awesome. Okay. The next book and the last one I recommend is also Saunders, but this is question and answer review. I love it because again, it's completed with 6 different exams, and it focuses on those content areas for NCLEX examination: physiologic integrity, psychosocial integrity, safe, effective care, management of care. So all these areas are focused in here, and the tests are delineated towards those areas. So it gives you a nice focus on what it is to really think about, let's say, management of care, physiologic integrity. It's perfect. Then test number 6 is a comprehensive exam that covers every single area. So I recommend that every student who is looking to pass NCLEX should go through all these examinations, find the time to study, find the time to go through these tests. So those are my 4 books that I recommend, and keep studying.